हेलो, वेलकम टू आरोग्या फिजियो टिप्स। आपका आरोग्या फिजियो टिप्स में बहुत बहुत स्वागत है। तो आप लोग कैसे हैं? हाउ आर यू गाइस डूइंग? आई होप द न्यू ईयर आर इज ब्रिंगिंग लॉट ऑफ अपॉर्चुनिटीज एंड ऑल ऑफ यू आर फॉलोइंग योर फिटनेस गोल हमारे साथ। So today it is very important topic. We have been talking about diastasis recti. हम diastasis recti के बारे में बहुत दिनों से बात कर रहे हैं और आज हम बहुत ही इम्पॉर्टेंट चीज बता रहे हैं, वो है ब्रीदिंग फॉर डायस्टेसिस रेक्टाई एंड हर्निया। पर आप ये वीडियो देखें उससे पहले इस वीडियो को लाइक कर लीजिए, कुछ कमेंट कर लीजिए, शेयर कर लीजिए। इतना करने में आपका क्या जाता है? हम इतना मुश्किल से एक वीडियो बनाते हैं और आप लाइक और कमेंट नहीं करेंगे तो कैसे चलेगा, बताइए। सो लाइक द वीडियो, कमेंट ऑन द वीडियो एंड शेयर द वीडियो, and there we go. So today we are talking about breathing, why breathing is important, and what kind of breathing you should do if you are a postpartum lady. Now, irrespective of whether you do have diastasis recti or umbilical hernia or any other postpartum complication, breathing will go a long way. So this is your glottis area, this is your diaphragm or chest area, this is your abdominal cavity, and below this is your pelvic area. Now all these are connected together like a sheet. You can see it here, right? Now this is like an umbrella. This actually forms a support system. Now when you get diastasis recti or postpartum tummy or umbilical hernia, this disconnects happen. It completely disconnect and you start doing shallow breathing, which is generally the chest breathing. So the first thing you need to do as soon as you deliver the baby is to start doing conscious breathing, slow, rhythmic, deep conscious breathing. आपको आराम से गहरी सांस लेना, और ये तो हर कोई ऑलरेडी लेता है, तो ये नहीं पूछिए कि कब से लेना है। आप जिस दिन डिलीवर कर रहे हैं और आपका पेन जैसे ही सेटल होता है, आप कॉन्शियस ब्रीदिंग स्टार्ट कर सकते हैं। Now let me differentiate between what is chest breathing and what is abdominal breathing. What we do here, which is very shallow, is chest breathing. If you see this is abdominal breathing. What we need to do is bring back the connect between the chest and abdomen. So you keep one hand on the chest, another hand on the abdomen, and let breathe 360 degree. This is called 360 breathing or umbrella breathing. Okay. So for 360 breathing or umbrella breathing, keep one hand here, keep another hand here, and take a long deep breath in and breathe out. One more breath in and breathe out. So when you are breathing in, जब आप सांस अंदर ले रहे हैं तो आप चेस्ट को एक्सपैंड कर रहे हैं, एब्डोमिन को एक्सपैंड कर रहे हैं, पुश करने की कोशिश नहीं कर रहे. यू आर नॉट ट्राइंग टू पुश द एब्डोमिन आउट, यू आर ट्राइंग टू expand the abdomen, expand the chest. Okay, and when you are breathing out, then you are trying to push the belly button towards the spine. Okay, this is 360 breathing or umbrella breathing. जैसे umbrella खुलता है और so वैसे breathing करना है. Important is to do it together and important is to do it deep and connect with it. That's the reason you can even close your eyes when you are doing it. Okay. The next one is pursed lip breathing. That means I breathe in from the nose and breathe out from the mouth. So breathe in from the nose and breathe out from the mouth. Breathe in from the nose. Breathe out from the mouth. Now very important is it is not forceful breathing, it is rhythmic. ये रिदम में चल रही है और बड़ी डीप ब्रीदिंग है, so it's not forceful at all. So you don't do no, not like that. Rhythmic, slow as possible. Now very important is in all the breathing you should not be lifting your shoulder, so don't do this. Okay, so lifting your shoulder is never an option. Shoulder completely relaxed, chest straight, abdomen open up. If you sit like this, then you can even keep your hands back and sit like this to at least practice it initially, or sit in a chair. Okay, आप कुर्सी में बैठ के भी ये पोज कर सकते हैं. बहुत इंपॉर्टेंट है कि आपका जो ब्रेस्ट है एब्डोमेन में सिंक नहीं कर रहा है, ये सीधा है पर ये ऐसे करके नहीं रखना है, इसको रिलैक्स रहना है, शोल्डर को रिलैक्स करना है. नाउ थर्ड वेरी इंपॉर्टेंट पॉइंट इज when we are doing any kind of breathing, we can also involve the pelvic floor muscles. So we have involved the breathing, we have involved glottis, diaphragm, chest. Now how to involve pelvic floor muscles? जब breathe out कर रहे हैं तो pelvic को contract करें, और breathe in कर रहे हैं तो relax करें. Now breathe in, breathe out, breathe in, breathe out. So it is important to contract your vagina when you are breathing out. So the third very important breathing is diaphragmatic breathing or side breathing. Now you can do that by keeping your hands on the side of the ribs, okay? And you can even keep it slightly tighter to actually experience it initially. So you breathe in and you breathe out. You breathe in and you breathe out. Diaphragmatic breathing can be done at here, just above your hip, or at here. Okay, again very important is don't do this. Don't elevate your chest. आपको chest को elevate नहीं करना है, shoulder को elevate नहीं करना है, आपको chest को expand करना है, as if ribcage is expanding. See? Okay, so that is the third breathing, that is the diaphragmatic breathing. Another breathing is side breathing, which is basically the diaphragmatic breathing, but you do it in side lying position, which is very good for hernia patients, postpartum C-section patient. उनके लिए ये side breathing बहुत अच्छा है. तो इसमें कुछ नहीं करना है, आपको side में लेट जाना है. So for the side breathing, you can keep your one hand here just above the hip, and you can breathe in and breathe out. Breathe in and breathe out. You should be able to feel your ribcage here as well as here, as if the expansion is happening and contraction is happening. Now side breathing, as I said, is very good for hernia patient and postpartum C-section patient. They should do side breathing. Another way you can do all these breathing is lying down on your back. So all the breathing which I said can be done here in this position. So lie down on your back. आप पीठ के बल लेट जाइए और दोनों पैरों को फोल्ड कर लीजिए. फोल्ड both the knees. Okay, it will be slightly apart. Relax your pelvic floor muscle. Relax your back. Don't overarch it. Very important is not to overarch. Relax your back. Relax yourself. Relax your shoulder. And now keep one hand on the chest and one hand on the abdomen. एक हाथ सीने में रखिए और एक हाथ पेट पर रखिए और वापस आप अम्ब्रेला ब्रीदिंग लीजिए. Breathe in, breathe out. अगेन मैं बोल रही हूँ, आपको ट्राई नहीं करना है कि अम्बिलिकस बाहर पॉप आउट करे, आप बड़ी ही सटल ब्रेथ, लॉन्ग ब्रेथ ले रहे, ब्रीद इन, सिमिलरली आप पर्सलिप ब्रीदिंग कर रहे हैं, और सिमिलरली आप साइड ब्रीदिंग कर रहे हैं यहाँ पे हाथ रख के। नाउ यहाँ पे हाथ रख के यू कैन ऑल्सो engage a muscle called transverse abdominis muscle. Very important for people who have doming. If you have not seen doming, then we will add that video and you can see doming here. Okay, so breathe in and breathe out. You should feel that you are breathing from right hip towards the left hip and left hip towards the right hip. You should feel that the air is expanding the hip on the side and taking it out. So all the breathing which we discussed in sitting can be done in this position as well. We can also do breathing with the help of TheraBand. It will engage the core muscles better. ये core muscles को और better engage करेगा. इसमें क्या करना है? Breathe in करना है. Breathe out. Breathe in. Breathe out. यही चीज आप लेट के कर सकते हैं. You can do the same thing in lying down. You can even change the angle. So breathe in. Breathe out. Breathe in. Breathe out. So every day you do 500 conscious breath. If you are not able to do 500 conscious breath, you can even do some yogic breath or pranayama. So one breath which you can do is Nadi Shodhan pranayam or Alom Vilom pranayam. So breathe in from the active nostril. Breathe out from the other. Breathe in from same. Breathe out from the other. You can put 2 fingers on the left nostril, thumb closing your right nostril, 2 fingers in between the eyebrows, and the other hand in Chin Mudra. Okay? How many of Nadi Shodhan you should do? You can do around 10 breaths, 20 breaths. You can go up to 10 minutes. The second breath which you can do is Brahmari breath in Swarnamay Mudra. 2 fingers on the eyes, 1 down the nostril, 1 down the lips, thumb closing your earlobe. Take a normal deep breath in and breathe out. In Brahmari, breathe in. You should keep your thumb on the earlobe and try to close it completely. How many breaths of Brahmari you should do? Around 7 to 8 breaths. This literally brings the stress level down completely. देखो मैं अभी एकदम दिव्य आत्मा लग रही हूँ. So that is all about wait, I am now gone into deja vu. So this is all what breath can do, and breath can really heal you. So pay a lot of attention to your breath, deep, conscious, rhythmic breath, and no force at all, and no movements of body. It's just subtle, deep breath, which you should feel from inside. Okay, so connect the core completely and keep doing it. Comment in the box that you are following it and how you are recovering, and we would love to hear such stories from you. So comment and tell us if we have anyways helped you heal. Okay, and witness your fitness with us. Keep breathing.